Hello, as Louise said, I'm Lou. I undertook a survey and patient questionnaire at Kingsmill Hospital earlier this year as part of their pre-optimisation hub for patients, which is built into their business case and their STP to try and improve the health within their local population, which I'm sure as a lot of you who may have worked there is quite a significant job. So it was a survey just to assess the pre-existing level of fitness in the patients attending pre-operative clinic and also level of obesity in those patients, and also asking them their own perceptions on what effect obesity has on their surgical perioperative journey through the hospital. Earlier this year, the government issued updated advice for adults about how much they should exercise, and there's been a lot of media campaigns telling people how much they should exercise. So during early summer this year, 162 patients were asked to fill in a questionnaire, of which 153 obliged. And we compared this data against those government targets and also asked the patients their personal feelings on the effect of obesity on their perioperative journey. So the patients themselves documented what they thought their BMI would be, what they thought a normal BMI was, how much they exercised, and then they were also asked on a scale of either no impact to significant impact how much they thought if obesity would affect their surgical outcomes, and every patient was asked that no matter what their BMI. And the preoperative nurse told us what their actual BMI was. So they were divided into three groups. There were patients that exercised less than once a week, so not at all. Those patients that exercise 1 to 2 times a week, and those patients that exercise at least 3 times a week. And the divide was roughly equal between those. There's about a third in each group. So for the patients that exercise less than once a week, we only asked adult patients for all groups. 2/3 of them were under 65. And out of those patients, only 4% knew how much they should be exercising, ideally. And only 15% of them knew what the ideal BMI range is. And some people said that they knew what their BMI was. They were totally wrong. Only a few patients knew what their own BMI was. And out of those patients exercising once a week, we asked them to estimate if they didn't know what their BMI was, and 40% of them guessed the correct range, but everybody else either over or underestimated. And the mean BMI for that group who barely exercised was 31.5. So the middle group, that's patients exercising 1 to 2 times a week on average. Still, not many of them, only 9% knew about the government guidelines. Only 9% knew about what a healthy BMI was, and only 3 of them knew what their own BMI was and were correct. And it was an equal split in age range again for this group. And the mean BMI for that group was 27.9, with, once again, many of them not being able to estimate their own BMI, so not really aware of their own body habitus. In the group that exercised the most, they were still equally, had no idea what the government felt that they should be, how often they should be exercising, but obviously they were exercising an adequate amount. They also were not aware of what a healthy BMI range was, and only 2 of them knew what their actual correct BMI was. Interestingly, this patient group, despite exercising a lot, their mean BMI was still above the recommended, and it was 29. That may not surprise some people who've done pre-op assessment in Kingsmill. So We also asked them as a separate, every single patient was asked what they, if you were obese, what that would impact on your surgical journey. And they were asked several questions. So they were asked whether if you were generally less fit, so you can't even climb the stairs, would that increase your risk of complications? So the red bars show the group that exercised the least, the orange group bar is the group that exercise the average middle amount, and the yellow bars are those that exercise at least 3 times a week. And as you can see, most of them felt that it would have a significant impact. And the same is shown for multiple questions that we asked them. So they felt that there was a significant impact on the risk of post-operative wound infection if you're obese. There would be an increased risk of post-op venous thromboembolism if you're obese. They also, all groups felt that if you were obese, you'd likely that you might have to stay in hospital for longer than those patients that weren't. And they also felt that it was, there would be a significant impact on the anaesthetist's ability to manage your airway and provide, or we sort of in brackets told them whether they could give it oxygen to explain it if you were obese. Although one person did say there would be no impact, and they did a little free text writing of because I have a CPAP machine. So I think this highlighted that there is, despite a lot of media campaigns from the government about exercise and trying to improve the general health of our population, that there is really poor education of the population that we spoke to. All groups, no matter how much they exercised, had a mean BMI greater than 25, which I think is significant. But we all know that weight is a multifactorial problem, and obviously diet has a massive impact, which we didn't talk about in this on this survey. And also, there's obviously the extreme groups where BMI is completely useless, but I felt that the number of elite athletes and rugby players in our pre-operative clinic wouldn't skew the results too much. I think there's a lot of scope for patient education in this, and this project is one spoke of a hub that's happening in Sherwood Forest hospitals to have a business plan to sort of work with the ICS to get more health organisations involved in the health of the local population. And they are funding in-house exercise programmes, and the GPs are all on board as well. And the hope is that this improves the not only the fitness level of the patients for their surgery, but also for them to go on with post-operatively as well for their life. So thank you very much.